Dr. Cindy, good to see you today.
So nice to be here. Happy to be here.
Tell me a little bit about your background. You're a medical doctor and you're interested in a lot of things that other medical doctors aren't.
Sure. So I am double board certified in internal medicine and integrative medicine. And I was always interested in health and well-being from an early age. Medicine was around me. My dad was a surgeon. So when I grew up, I was thinking about being a physician from the start. And I worked really hard, going to all the top schools, Ivy League education, checked off all the boxes. And then along the way, I actually had my own journey with burnout and I got sick. And so I woke up one day not being able to see. And this was terrifying. And that's what I talked about in my TEDx talk. And that was really a wake up call for me to really pause and really think about what was actually going on in my life. And so at that point, this was more than 10 years ago. I was completing residency training. I was already a physician, but that really allowed me to dive deeper into my own health and wellness journey. It took a while to get a diagnosis initially. So I was this medical mystery, which was terrifying. And I remember going to see the doctor, them not having answers for me. And a while later, getting a diagnosis that I had this rare autoimmune condition impacting my eyes, an inflammation of the eyes that could have led to full blindness. And so that point really allowed me to pause and dive deeper into health and well-being and to look more holistically. And so I brought in integrated functional medicine, complementary modalities, mindfulness coaching, energy healing, and all of these things. And thankfully, with all of that, have been able to heal my eyes. And so I really believed in the importance of holistic health and looking at the whole person in order to be healthy and well. And I'm grateful to have a lot of the experiences, trainings academically, but also really have since looked and dove into other modalities that may not be as mainstream or traditional, such as energy healing and various modalities like that, and really feel grateful to be able to bring it all together to help people on their wellness journey.
You're a clinician, you see patients, which is somewhat different than other people who talk about these different modalities because they're not actually using them on patients, right? You are. And what are you seeing?
So I do see patients, and I also do have a wellness consultancy. So I'm happy to be able to serve in multiple ways. I think when I look at patient care, it's really taking a holistic approach. Yes, we bring in the lab work, the data and all of that. But I think it's also really important to look at the person and who they are and talking about not just of course, their diet, lifestyle, all of those things, but also I know we talk about mindset and the importance of that. And, all of those things really, I think, play a role in this person's overall well-being and their health. And so it's very personalized.
I'm just going to tell the listeners how we met. So we met in Scotland, some electronic communication, and then I saw you and you came up to me. And I'd like to get a sense of where doctors are at. I always ask this same question. I said, well, what's your feeling on LDL cholesterol? And I was expecting an answer. There was a number attached to it. And you refused to go there. You were just, no, you wouldn't give me a number. And you said, well, that's like part of it, but there's like all this other stuff to think about too. And I thought, oh, that's so interesting. So I'm curious when people come to you and you incorporate, because as you said, you're doing blood work, although you're not telling me, you do have an opinion on LDL levels.
Yes.
I'm sure you do. But your approach to dealing with that. So if somebody comes in with a number that you're not happy with or you feel is dangerous for them, how do you interact with them?
Yeah, well, I think it's important to have a conversation. And of course, we know there are reference ranges and, different levels that are more recommended. And you look at different risk factors and all of these things. And many calculators out there to, of course, stratify your risk, project out 10-year cardiovascular risk, all of those things. I think the reason I had responded in that way was a lot of times I find that, especially with data and numbers, there's a tendency to focus on the number itself. And, maybe we say, okay, it should be less than 100 or, whatever it is. And for some people, all their focus is on getting that number to that goal. And I think that can be helpful, but it's also important not to forget the other things in the picture, right? In terms of how are you actually getting there? Are you actually taking care of your mind, your body, holistically? Like, what's your diet like? Are you starving yourself to lose weight, right? Or are you having a balanced diet? Are you having enough protein and exercise? And how's your sleep and all of these things? And so I think, especially as more and more technology comes through and wearables, I think it can be very helpful, absolutely. But I always still encourage people to not just focus on one particular metric or measure, but to really stay connected to who they are and how they're feeling in their body.
Let's go to that. I'm not throwing shade on you about refusing to answer my question. I thought it was fascinating. I was like, oh, that's so interesting. There's more to this. That's what brought you on the podcast today. I want to say I'm not after you for that. I just thought it was really interesting. So this idea of knowing yourself, that's such an interesting question. Like, there's a lot of ways to measure ourselves now. There's a lot of wearables. A lot of us have access to lab work and such. But what I'm hearing from you is something different. That's not about numbers. It's about something else. Talk to me a little bit about that. Like, if somebody comes into you and you want to understand how they understand themselves, how do you discern that?
That's a great question. So I think that this conversation definitely depends on the individual, right? Because some people, they come in and they may not be as curious about this aspect because I think a lot of times, traditionally, when people think about healthcare, it's about the lab work. It's about, the blood pressure numbers and that's absolutely important component. And I think this is more geared towards, especially if you're looking at optimizing and, kind of more the other aspects of your health. I think it's really looking at quality of life, it's satisfaction, fulfillment, and, those qualities and conversations that I don't think, unfortunately, a lot of times physicians are able to have with their patients due to limitations in healthcare settings and things like that. And I think just overall, how people feel, sure, mentally, emotionally, but also in your body. A lot of times people will say, sure, I've seen doctors and they just tell me my labs are fine, but there's something going on, right? There's something there. And I think it's important to be able to create and hold a space for people to explore that, right? And to have different practitioners who have different areas of focus and specialty who can really explore that deeper with individuals, whatever is going on for them.
Do you find gender differences in that conversation?
Yeah, definitely. I would say that in general, women are more open to these conversations. But I will say that I'm encouraged to see that there are more men who are taking a more active approach in their health and well-being, which I think is really important. I think in the past it was more, oh, my wife sent me here and, I'm just here for the annual and just kind of checking off a box. But I think what I'm seeing, and I think it's overall just with the more education and awareness about health and well-being. And I think it's a really good trend, that people are being more engaged in their own health and well-being and really bringing in different treatments, modalities, practices to optimize their well-being.
As you're describing this, I can envision my wife or any of the women I know going in to see you and saying, like, something doesn't feel quite right. I cannot at all imagine my guy friends going into you and saying, something feels a little off. I mean, they would come, like if their leg stopped working, or like you, like they couldn't see, then they would come in. They would be like, yeah, something's wrong. But I think it's a little, I don't know, we guys are sort of programmed to just like ignore things that hurt.
Well, I will say that I do see more men being open to these
Mm,
conversations. And I think part of it is, I think the main thing is when you rule out that something, quote, serious is going on.
right.
And, when a lot of the things look like they're fine, yet something is still going on, like they're still having symptoms. And a lot of times the symptoms are not, it's not something necessarily very, very significant, right? But it could be a nuisance that's kind of ongoing. Maybe it's kind of, they're just sinus problems or whatever. It's impacting their quality of life, right? To a certain degree. And I think that definitely impacts your overall mood and well-being over time, right? When you can't figure out what's going on. And if you've done so many scans and tests and something is still there, then I think that really invites that conversation of like, what else is going on and what can we do about it?
That can be a very, very difficult knot to undo. Those are always the tricky questions, right? Like there's something is manifest, like your eyes aren't working. Okay, that's clear. We have an issue. We look at all this blood work, everything's fine. Why your eyes not working? And then that gets really complicated. So, talk to me a little bit about this idea of the like mindset and this connection of mind, body, spirit. As a physician, how do you impact that? If somebody comes in and their mindset is not really where it should be, it's not a prescribing of a thing, right? I don't think. How, as a physician, how do you deal with that?
Yeah, I think it's interesting because I think a lot of people with mindset, it definitely usually requires a level of self-awareness,
Yeah.
right? In terms of understanding your thinking patterns, your beliefs that kind of essentially have allowed you to manifest whatever has happened in your life. And so I think it really, I see it more in terms of the conversation, more commonly seen in people who have been really committed to their own growth and development, right? And who are high performers. And a lot of times, people who really want to improve and grow in many ways. And I think when I talk about mindset, I think it's important to, of course, meet the person where they are. And it's really important you don't just, because I'm sure you know that when you've talked about it, where if there's too big of a jump between this person and another type of mindset or belief, there's too much cognitive dissonance, right? That difference, and it's not going to even be received or registered. And so I think it's important to really have, again, a safe space and open-ended conversations, right? In terms of open-ended questions and really exploring that with someone. For example, someone with a chronic disease or condition. I've had patients with diabetes and be able to bring in various lifestyle changes, and their A1C is so much better now in normal range. And there are people who may receive a diagnosis and feel like that's their life sentence. Like they're always going to be a diabetic, they're always going to have high blood pressure and all of these things. And so I think it's interesting to have that conversation and to really also present the other side to people to see that a lot of the conditions that people have, they're lifestyle related, right? It's related to inflammation, it's related to how we're eating and moving and all of these things. And so I think, yes, there are medications and of course various treatments, but I do think it's really important to work on the mindset piece about presenting, as you had shared in your keynote, about optimism and about really the possibility of being well and what that looks like, and exploring that together. And stepwise process, right? You're not going to go, for example, someone who wants to lose weight. And, a big part of that journey actually is, yes, of course, eating healthy and moving and all those things. But I think, especially in women, a lot of it that I've seen and worked with is learning to really feel safe in your body,
Hmm.
to love and accept yourself and your body. Mindset plays a big role in that, right? And you're not going to be able to, one thing I say is you cannot hate yourself thin. Okay. A lot of times people are a certain weight and they're very unhappy there. And they are constantly, maybe they're starving themselves. They're eating very, very little amounts of food. And they're just every day wanting that scale to change numbers, right? And I think a big part of it is, yes, you can do a lot of those things and in a more healthy and supportive way, but it's also really important to develop that relationship with yourself. And I think mindset plays a huge role in that too.
I think that's so well said. You really can't hate yourself into wellness of any kind. It's the other side. You have to love yourself to want to make these changes and for them to happen. I have some issue with the body positivity movement is I'm going to get in trouble for this, but you know, I think accepting a disease state as being okay is not okay. But at the same time, I think one can separate those two things and love oneself and still say like, okay, I got this, I got to deal with this thing because I love myself. I don't.
Yeah. And I think how I would say, how I see it and present it usually, I think a lot of times people may see acceptance and feel like it's almost like giving up or complacency. And it's not. There's a difference. And I think about it as being really, acceptance is actually really being present to being aware of what is, right? So it's like, okay, you get an A1C of an 8, right? So you technically have diabetes. And you can either accept that and know that, okay, that's the current reality, or you could be like an ostrich and, put the head in the sand and ignore that. But I do think that when you have that acceptance and awareness, I see it more like awareness, that's when you actually can do so much more. Right. But a lot of times when we don't have that acceptance first and just being aware, I think we oftentimes can go into denial and rejection and all of these things and kind of delay a lot of what we can actually be doing to help ourselves on that journey.
It's an interesting conversation that I've had with a number of people. And it's a gentleman who goes to my pool up here. I'm just going to call him Ben. I saw Ben about a year ago, and he's 14 years younger than me. He looks like he's 10 years older than me. He's probably 150 pounds overweight. And he was looking at me, he's like, wow, you're in great shape. Like, what are you doing? And I said, well, Ben, it's not that hard. Like, you just do these things. He's like, oh, that wouldn't work for me. It's like, well, help me to understand a little bit about you, Ben. What do you have for breakfast? Oh, I always have a big gulp of Coca-Cola and I like a slab of bacon and eggs. And he's telling me these things. And I said, have you been to a doctor recently? And he's like, oh, yeah, they tell me I got to stop that stuff. And it's like, well, they're right. And I saw him again recently, a few months ago. And I asked him again, I said, so how's that going? He said, well, I've traded out the Coca-Cola for orange juice. I said, well, okay, that's a slightly less okay. Okay. He's like, I gotta have that, like, he eats some like dozen eggs or something. It's like, okay. He is a fellow who has a belief system that says that he's running an ROI on this. And he says to himself, this won't work for me. It may work for other people. And there's this sort of grim acceptance. He told me his numbers, and I said, his A1C was like, I don't know, it was like 8 or something. And his total cholesterol was like 300, just some crazy numbers. And I said, well, listen, like, you're not going to live very long. Like, I can just tell you this. This is where this is going. Are you okay with that? And he's like, oh, no, I'm going to. It's like, okay, good luck, Ben.
It's interesting because that reminds me of a conversation I had with a patient a while back. And she basically a lot of her numbers were it was actually my first time meeting her, and she had a bunch of these diagnoses already, chronic disease, and her labs were just really elevated, not in a good way. And we actually had a very, I would say, honest conversation. because I was just presenting the facts to her.
Yeah.
And she was, I think, in her 60s. She was Asian, and I'm Asian. And she's like, oh, well, Asian food, there's a lot of rice and this. And I just love that, eating that food. And I was like, okay, I mean, I think at some point you have to make a choice. And are you okay with that choice? Right. And she was like, well, maybe it's like, she's like, well, does that mean I have to suffer and not eat any of the stuff? Or maybe I just eat and enjoy my life and then I die in 5 years.
Okay.
So, you know what I mean? It's just very interesting, David, because I think there are people with all kinds of, mindsets and beliefs and, backgrounds. And I think that it's just important to have this kind of conversation so that they can feel, empowered in a way, right? That works.
I puzzle over this a lot, that some people, and I feel really like holier than thou here, and I'm not, I mess up all the time. Everybody, I eat frozen pizza on Friday nights. I really do.
No one's perfect. Don't worry.
Because I like it. But you see people that I remember speaking to Joan McDonald, I don't know, 4 or 5 years ago. She's kind of famous now, but she wasn't then. When she was 70, she was 220 pounds, bag of meds, and things were not going in the right direction. And her daughter, Michelle, was a trainer. And Michelle's not a touchy-feely kind of gal. She's a real take no prisoners sort of person. And she went up and saw her mom and said, okay, this is the way this is going to go. You're going to probably spend the next 10 years slowly dying in a hospital with tubes in your arm, or you're going to come down with me and we're going to train, and that's going to be hard. And you get to choose, but I'm not in for the hospital bed thing. So you want to see me again, this is what we do. And she left. And so Joan took choice B. And 4 years later, Joan's 74. She's 130 pounds, and she can do 10 dead hang pull-ups with a 25-pound weight, which,
Amazing.
and she's totally buff, and there's no more meds. And 70-year-old woman who has zero athletic background did this. And so that the door opened and she walked through, because she's like, okay, Michelle's threats were strong. She believed. That doesn't always happen.
No.
I
Yeah.
puzzle about that.
Well, it's interesting because in medicine and clinical training, a lot of times there's a technique called motivational interviewing. And it really is a very helpful way, I think, of connecting with patients, and really about, asking open-ended questions, holding space, and really helping people get to, their own motivations and goals. Because everyone is different, right? For one person, it could be because they want to be healthy enough to play with their grandchildren, right? For someone else, it could be to be healthy in their relationship for as long as possible. And so it's very individual. And I think that's why I really think it's important to be able to have a conversation, to really have a team, really a healthcare team around you, right? Who have their various expertise, experiences, and to support and guide the individual on their path. And I think the other thing, the important thing I like to share is also, depending on where you are in your life, you also need different things, right?
Yes.
And I think that's really important to honor and to pay attention to, right? Because what worked for you when you're 30s and 40s may not work in your 60s and 70s, and that's totally okay. It doesn't mean anything has gone wrong. Also, the body has its various natural changes with hormones and all of these things. And so it's really about working with the body and having a team who can support you through all these stages and changes so that you can really be at your best.
So you used two words there, support and guide. And I think that what's very interesting is that you're double board certified and you're aware of energy medicine, you're aware of Ayurvedic, you're aware of a lot of things. And for most people, myself included, there's like a lot of things out there. And so, okay, what do I do when? What does this do? Is this complementary to this? Does this work against this? How do I manage all that? So talk to me a little bit about that sort of support and guide through that sort of a journey.
Yeah, well, I mean, I'm very grateful that I went on my own journey. And I think that really has helped me so much in terms of how I care for patients, clients, and the such, because I think we all have our own journeys and experiences and our own learnings. And so I think for me, I've just always been very curious and always wanted to explore different modalities, healings, treatments, stuff like that. And so I've always like kind of dove in first to try it out myself. And I just didn't feel like I could recommend something if I wasn't really familiar, comfortable, have, experienced it. And so I think that for people in general, if they are interested, I think it's really, that's why I think integrative medicine, functional medicine practitioners who are trained in these areas really offer a lot to patients, I think, because they take that more holistic approach, right? It's not like I'm an acupuncturist, but I receive acupuncture regularly and I'm familiar with points and all these, things like that. When you can work with someone who has just a more broad scope in this way, they're able to guide you to seeing particular practitioners, specialists, and things like that. I think that's really helpful. And knowing that, it's not just one person will give you all of your care, right? And I think that what I see in especially the Western healthcare system, I think that a lot of the problems exist because there's not a lot of communication, right? You go see one doctor and then maybe they send you somewhere else, and then the medical records don't talk to each other. They're different hospitals or clinics, and it's very frustrating for patients and for the clinicians, because there may be changes, medication changes, whatever, and nobody is talking to each other. And so I think that definitely, that can lead to frustrations and definitely impact quality of care and outcomes. So I think it's really just helpful to, number one, be aware yourself, right? Taking responsibility, being accountable and aware, and also working with practitioners who do take more of a holistic approach so that you can really get the care that you deserve.
The situation with the siloed medical practitioners, that's within a conventional medical system. Going outside of that, a MD speaking to an acupuncturist or an energy healer or somebody, I've never heard of that. That would be amazing.
I hope that I believe that integrative medicine is the future. I think that the health of people, it's especially in the US, it's not really going in the right direction in many ways. And with healthcare costs increasing significantly, constantly. And so I think a lot of these modalities and treatments can really offer synergistic benefits and to really help you overall. It's not that, I think sometimes also I like to just word of caution this. Sometimes I think people, they're very extreme. You're either all Western medicine, right? Only medications, show me all the science, all the data. Or it's the other side where they're like, I'm never seeing a doctor, only doing supplements and energy healing and whatever. And my perspective and approach is why do we have to choose, right? And I think there is, it's a spectrum, and that every individual falls somewhere along there. And it's about really bringing in the different things that work for you. And also I think it's being open to it, right? Because I think a lot of times people who are maybe very used to seeing Western medicine, maybe a lot of times they feel like a pill is their answer, right? And for certain things, it can work very well. And of course, like if you break your arm, like you please go to the hospital, right? But I think it's also really understanding like there are so many other practices, in terms of mind, body, mindfulness, meditation, like all of these things, diet, lifestyle practices that can really, really improve your health and well-being. And, getting back to that person you mentioned earlier, just various little tweaks in terms of, his habits could really move the needle. So yeah, I hope more and more people are open to that and bring that into their lives.
It's such a fascinating thing. My experience with prescriptive medicine is awesome. I'm totally on board. I had a wacko autoimmune thing that put me in the hospital for a year. And thankfully, they took out my spleen and I'm fine. So no amount of like, other stuff was going to work. That was great. I'm alive because of that. To me, a lot of the things in, especially prescriptive medicine, it's like a hammer. It's like, boom, like you get, it's an immediate targeted effect, especially, prescriptive drugs are highly targeted for this thing. And sometimes there's some off-target effects, but generally that's what they're designed for. And other things that are a little fuzzier, it can be a little harder to be like, oh, I did this and I don't feel super awesome, or this whatever issue I have is here and I've already done one treatment. So, you know what I mean?
Well, and I think also a lot of times there's a tendency to want that quick fix.
Exactly. That's where I'm going with this. Right.
And I think that a lot of times prescriptions, medications can offer some of that.
Yeah.
But sometimes it's more of a band-aid, right? And
True. Yeah.
may not necessarily actually get to the root cause. And so I think it depends on the person, right? Some people, and also how ill they are, right?
Yes.
Because if it's a more minor ailment, right? And, taking a pill periodically helps it, then maybe that works. But if it's more something really significant and it's impacting like their whole microbiome, like their skin and everything, like, it really probably would benefit from a more kind of holistic and intensive
Right.
reset. So
Yeah.
I think it really depends.
Yeah. 100%. As we sort of wrap up here, you sent me an email about a resilient nervous system. I love that idea. I want a resilient nervous system. Talk to me a little bit about that.
Yeah, I think it's so important to really pay more attention to our nervous system. I think we hear more about like the fight or flight, right? And being in
Sure.
sympathetic overdrive. And I think a lot of times, I think we see more and more whatever disease or condition at the root is inflammation.
Mhm.
And a big part of inflammation for a lot of people is stress.
Yeah.
And so I think in terms of the nervous system, that's a big part of, the stress pathway.
Right.
And so the nervous system, just big picture, broadly, essentially think of it as two sides, the sympathetic nervous system and the parasympathetic nervous system. So the sympathetic is really activated when we're in stress, danger, really preparing the body for action. And, essentially that's why they call it fight or flight, right? And when that's activated, like all our organs are activated to help with it, heart rate increases, muscles tense up, stuff like that. Various hormones are also released to help with that, cortisol increase, stuff like that. And then on the other side, there's the parasympathetic system, which is helpful for relaxation, recovery, and balance. And so when that system is active, then certain body systems are, for example, digestion is usually more activated during that state. And that's why, if you're always stressed out, sometimes people complain of like a nervous stomach, and stuff like that. Essentially, if your body is always in that sympathetic state, it's in stress, right? So it's going to help you survive. It's not really thinking about digesting foods and stuff like that. And so basically, the reason I bring it up is because a lot of times, sometimes I think people think about stress and they think it's terrible and you shouldn't have any stress. And so that's actually not the case, right? Like the body is meant to adapt and handle stress. I think the problem is chronic stress, where
Mhm.
you are constantly under stress. And in those states, what happens is you're constantly in that sympathetic overdrive. And so that's usually when, that really can lead to inflammation, anxiety, accelerated aging, and all of those things. And so I think it's important to have various practices to help you work with your nervous system. And a lot of times it's things like breath work, mind body practices, vagus nerve stimulation. The vagus nerve is a very important nerve to help with activating the parasympathetic relaxation response. And so hence, people a lot of cold exposure, humming, chanting, stuff like that. So I think it's really just recognizing that we're human with very complex, right? We have different body systems, hormones kind of that are working in sync. And it's important to just pay attention to the messages that our body is sending us, right? Like a lot of times I find that people don't really recognize that they're stressed, right? It's like, how do you know, where does stress show up in your body? Is it you're like, for me, I hold it in my neck and shoulders, other people hold it maybe in their hands and their belly. And so I think it's important to just develop that awareness and resiliency so that you're able to essentially switch, right? And to not always be in that sympathetic activated state.
How did COVID affect your practice?
Well, it definitely was a change. So I was seeing patients in person in clinic, and then I shifted to telemedicine practice.
And I'm curious, the question is more about like the patient populations. When people get COVID, it's never good. There's sort of like degrees of bad. Are you seeing a population of patients come in who have enduring COVID symptoms? Or so if somebody comes in with something like that, we're not giving out practical medical advice here, guys. So I'm just curious, like something like that, how would you deal with someone like that in terms of these other modalities? Are there other things that you would bring? Because to my knowledge, Western medicine is just like they sort of throw up their hands.
Yeah, absolutely. So I know that there are various long COVID clinics that have popped up around the country, which I think is great for, have been supportive for some people. I do think that, again, a lot of times what we've seen is that essentially there's inflammation in the body,
Mhm. Yeah.
right? After this infection. And in certain people, and it just, how I describe it to patients is it's essentially inflammation that shows up in different ways for different people. So, for example, someone may have a lot of joint pain, right? And that's inflammation, like arthritis, that's inflammation showing up in their joints. Someone may have a lot of rashes, right? And that's inflammation in their skin. They might have sinusitis, that's inflammation in their sinuses. Like, and so at the core, it's inflammation. And so I think that there are definitely a lot of modalities and, of course, supplements, protocols, and things to help with that. And every individual is, of course, unique in terms of what works for them. And also diets, right? Like there are certain foods that, yes, probably universally work. And I think we know, of course, we need fiber and protein and all these things. But the specific types, like, there's variation, right? Depending on what works for your body, composition, and all these things. And so I think it's important to definitely look at inflammation from that broad perspective. There are definitely supplements and more experimental treatments that are available, right, for people. And I think that depends on the individual's, of course, their medical history, their level of engagement, risk tolerance and all these things. But I definitely have seen improvement with long COVID and things like that. So I think the big thing to remember, and I hope people will see and absorb, is that I absolutely believe in the body's ability to heal and that it's capable of healing. And we just need to support the body through in whatever way makes sense. And because every individual is unique and has your own genetics and, all these things, the things you require may be a bit different. But I do believe, and I think that's where mindset also comes in, right? Someone can have a diagnosis, but if they don't believe they're going to get better, they don't believe it's possible, then it's almost like there's a ceiling, right,
Yeah.
David, on how well they will ever be. And I think
Yeah.
that's really unfortunate because how will you know, right? It's almost like it's a self-limiting
Yes.
for prophecy in a way.
You bring to mind my buddy Wim Hof. Let the body do what the body can do. He's so right.
Yeah. And I think a lot of times I feel like we try to override, what the body is telling us, what it needs. And I think there's a balance, right? We want to honor like what's going on and really do bring in as much as we can to support that healing and recovery.
Dr. Cindy, it's been wonderful to have you on. If people want to get in touch with you, what would they do?
Sure. So feel free to visit my website, cindytsaimd.com, and that will have different contact resources. And also I'm on social media at Cindy Tsai MD on LinkedIn and Instagram primarily, and happy to be a resource.
And Tsai is spelled Tsai.
Correct.
Wonderful. Thank you so much for your time today. Really enjoyed
Thank you
it.
so much, David.
Bye now.